Good evening, and it's great to have you with us here as we near the end of another week together. We do have a lot to get to tonight, and we're going to begin here with news of that potential third COVID vaccine that could soon be used in the fight against the virus right here in the U.S. Johnson & Johnson's vaccine is being called a new weapon tonight. This time it's just one shot, faster to produce. The company releasing its phase 3 data showing the vaccine is highly effective against severe disease, and the company saying it prevents hospitalizations and death. The U.S. now reporting more than 435,000 American lives lost, more than 4,000 deaths in just 24 hours. Many will remember those numbers we reported on the Pfizer and Moderna vaccines, roughly 95% effective at preventing even moderate disease. Johnson & Johnson tonight saying its vaccine is 66% effective at preventing moderate disease, but that it's 85% effective against severe disease, 100% effective at preventing what we fear most, hospitalizations. Highly contagious new variants showing up in the U.S., adding a sense of urgency with all of these vaccines. Dr. Anthony Fauci warning that the UK variant could become the dominant strain in the U.S. by the end of March. And tonight, the new head of the CDC now saying that we should be treating every new case as if it's one of these new variants. And this image tonight, hundreds of people lining up for shots in Seattle overnight when they learned they had an earlier opportunity, a freezer failing at a medical clinic, forcing authorities to use the vaccine they had and much more quickly. Johnson & Johnson planning to request emergency use authorization now from the FDA as early as next week. So what does that mean for timing? We're going to break it all down for you tonight. Dr. Jha is standing by, and we begin with ABC's Whit Johnson leading us off.
Tonight, a new weapon on the horizon in the fight against the virus. Johnson & Johnson announcing its one-dose vaccine is effective at preventing COVID-19.
I'm really hopeful that we will have another tool. We will have another vaccine that we can produce in large quantities and get out to the people.
It would be the third vaccine in the U.S. Johnson & Johnson says their vaccine was 66% effective overall in preventing moderate disease, 85% effective against severe disease, and 100% at preventing what we fear most, hospitalization and death. Pfizer and Moderna are about 95% effective at preventing moderate disease, but Dr. Fauci making it clear this new vaccine is a game changer.
This has important potential and real implications both domestically and globally, because as many of you are aware of, this is a single shot vaccine in which you start to see efficacy anywhere from 7 to 10 days following the first and only shot.
The vaccine also tested in South Africa, where that highly contagious variant is raging. The efficacy fell to 57% for moderate disease, showing how a strong variant can chip away at vaccines.
This is a wake-up call to all of us. We'll have to be nimble to be able to just adjust readily to make versions of the vaccine.
And the CDC director saying assume every single case involves a variant.
I think we should be treating every infection as if it's a variant. We know that these viruses are going to mutate. They generally mutate to the advantage of the virus, and that's how we get these more dominant strains.
The more infectious UK mutant now expected to be the dominant strain by the end of March, adding even greater urgency to vaccinate millions.
New York is desperately trying to ramp up the speed of the vaccine rollout with mass vaccination sites like this one here in Queens, an effort to reach thousands of people in one of the areas hardest hit by the pandemic.
Rhonda Sanford finally hitting the jackpot.
You spent an entire day online just trying to get an appointment?
I've been spending weeks calling and online until you just give up and you walk away.
Health officials determined not to let vaccine go to waste. When a freezer failed at a community hospital in Seattle, teams scrambled to set up overnight emergency vaccination sites and got the word out.
I put up the back call and we arrived within an hour and a half. We just have a lot of people who care a lot about and very passionate about making sure the community gets vaccinated.
I heard that it has to be used tonight, and I was like, tonight? You know. So I took the opportunity.
In just over 4 hours, all 1,600 doses were given out.
So let's get right to Whit Johnson. He's back with us tonight from Johnson & Johnson headquarters in New Jersey. And Whit, if authorized by the FDA, as we've said here, this would be the third vaccine available in the U.S. So give us a reality check here. How soon could this happen?
David, Johnson & Johnson plans to apply for emergency use authorization next week. An independent advisory board would then review it, and the FDA could authorize with shots going into arms by the end of February. David.
All right, Whit Johnson leading us off again tonight. Whit, thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.